My name is Chioma Okafo, and I'm a Country Program Manager on the USAID Achieve project at PACT. Achieve stands for Adolescent and Children HIV Incidence Reduction, Empowerment, and Virus Elimination, and it is a 5-year global effort to reach and sustain HIV epidemic control among pregnant and breastfeeding women, adolescents, infants, and children. Achieve currently works in Burundi, Dominican Republic, Namibia, Nigeria, Rwanda, South Sudan, Tanzania, and Zambia. Now, we know that communities affected by HIV have been providing feedback on the quality of service provision since the early days of the epidemic. However, the collating and use of this information has not always been systematic and sometimes lacks the perspective of service users. So today I want to speak to you about community-led monitoring and momentum as a tool for inclusive development. We have heard the term community-led development, which really builds on the Sustainable Development Goal 16, building participation, effective accountable institutions at all levels that start at the level closest to the people. Community-led development also looks at how we work together to create locally owned visions and goals, putting local voices in the lead as a way of achieving systemic change. Now, what is community-led monitoring and momentum, or CLMM? It is a way of allowing communities design, implement, and carry out routine ongoing monitoring of the quality and accessibility of HIV treatment and prevention services. This process helps development practitioners and programs to pinpoint persistent problems, solutions, or enablers, and barriers to service uptake at the facility and also at the community level. Not only is it crucial for gathering information regarding HIV service delivery, but it places communities and patients at the center of the HIV response, which is critical to controlling the epidemic. In 2021, the Achieve project conducted a review of community monitoring tools, along with in-country consultations in Eswatini, Nigeria, and Rwanda. This led to the development of a CLMM toolkit that engages communities in monitoring and assessing HIV service provision. The idea for the toolkit stemmed from the need to build meaningful relationships in the services and support we provide through reflection, dialogue, and action, from the beneficiary to the service provider through participatory feedback that allows for continuous program improvement. When we talk about reflection, where are we and where do we want to be? Connection, talking to others and helping them understand the situation and the urgency. Dialogue, trusting open and honest conversations. Action, taking meaningful steps towards the changes that we want to see. Therefore, the tools were designed to elicit feedback at the client level and can be adapted to use by civil society organizations, community-based organizations, or other community stakeholders and service delivery providers. Ultimately, the CLMM toolkit helps teams to be intentional about maximizing service outcomes and seeing service provision as not something we do to our clients, but something that we do in collaboration with accountability at the core. Now, to discuss the pilot implementation of the toolkit, I will hand it over to Manji Ephraim-Renshwat, Achieve Nigeria Project Director, to discuss the toolkit design.
My name is Manji Ephraim-Renshwat. I am the Project Director for Achieve Nigeria. A wise man once said, feedback is the breakfast of champions. That's why for us in Nigeria, we feel the CLM toolkit is coming at the right time. This is because it provides a direct opportunity for beneficiaries to add their voice in determining the quality of services being provided. We are excited about the entire process. We plan using a bottom-top approach in addressing feedback that will come through the process as we roll out the toolkit in Nigeria.